Hello dear friends, today we are going to discuss about tips for increasing your results in Typanoplasty. So first tip and first and foremost for any Typanoplasty case to make a good outcome is to just make it a dry perforation. So you should take all the efforts to make it a very dry perforation. So either with oral drops or systemic antibiotics. If it is, those systemic antibiotics don't have much role, but antibiotic ear drops will definitely make your perforation dry, and it should be at least 3 to 4 weeks before you take up your case. Second is your perforation. So all the margins, both anteriorly, superficial and deep margins, should be very freshened. So take all efforts to make it a nice perforation, and all the margins should be very cleanly raw. And then exposure is again very important point. So you should expose your microscope in such a manner that it should give you a very good view. And also while you are elevating, try to avoid touching skin anteriorly, because once it starts forming blebs, it's very difficult to remove that bleb, and your results will fall down because of not having nice exposure. So fourth tip is that often we get very foreshortened malleus, and we forget to raw the edges of the malleus. So whenever you get a foreshortened malleus, try to anteriorly fracture the malleus tendon and then place a small piece of cartilage, so that it should not fall back over the promontory, and your result should be substantially improved by that. And also make every part of the malleus raw, so that your result should improve. And then here we are placing the temporalis fascia, and all the edges should be well inside the perforation, and all the perforation margins should be seen. And sometimes we have very deficient anterior quadrant, so in those cases we can augment the anterior quadrant by a small piece of or a small cycle of cartilage. Try avoiding placing anything over the round window, because if you place cartilage or anything over the round window, your results may go down again for a healing point of view. And at the end you see a nice perforation, and your margin should be well inside. These 5 to 4 points will increase your outcomes. Thank you. So these points will really increase your outcome. So to summarize these points, so first is make a dry perforation. Second is exposure should be very good by setting up a microscope, and preferably at 2.5x. You should not be too high magnification. And third is, while manipulating your tympanic membrane, never touch your anterior canal skin by sickle or with any instrument, because it starts to form blebs there, and once you start forming blebs, it's very difficult to control the bleeding, and also your exposure will go down. And then margins of the perforation should be well freshened, both superficially and undersurface should be well freshened by your undersurface knife. And all around the perforation margin should be very nicely freshened. And then foreshortened malleus should be tackled nicely. So once you tackle the foreshortened malleus, so try placing a small piece of cartilage, and try to make a malleus raw everywhere, so that your graft uptake success will increase. And sometimes your anterior margins are not sufficient enough. In those cases, you either go with the intellar typanoplasty or try to place a small piece of cartilage there. And it should be a very thin piece of cartilage to augment the anterior annulus on the anterior side. And so the anterior blunting should not happen, because anterior blunting will cause lot of problem in hearing. And last one is, always try to avoid placing any gel foam or cartilage at the round window area, because that window should be very well open and ventilated. We should not put anything there. And middle ear space should be maintained every point of time. So while placing a cartilage, every effort should be made to just not to place anything at the center of the tympanic membrane, just at the edges of the after placing the edges nicely under surface. And then we can augment little bit anterior annulus or anterior side by small piece of a cartilage or thin strip of cartilage. And these points are very important.